Yes, thank you for having me here. My name is Petra Hoogendoorn. I'm coordinator of the Label2Enable project, and I'll tell a bit more about Label2Enable and the EHDS. So in short, you can already see on the left, we have a quality label for health apps, health and wellness apps, CEN ISO 82304 Part 2, with an overview of the app icon, app name, which platforms it's on, who made it, what's the benefit of the app, when do you first go see a doctor before using an app or a health professional, and then 4 scores, healthy and safe, easy to use, secure data, robust build, which add up to an overall health app quality score. You can easily see this is inspired by the EU Energy Label. And then when the app was last checked. So why health apps? In short, the potential and need as specified as well in the communication on the digital single market. There's more and more people growing older who have chronic diseases and they have an effect on our health budgets. And previously has been calculated that health apps can have a significant effect on healthcare costs. There's a potential in access and quality to the quality of care, and we have a shortage of healthcare staff, and technology can help and health apps can help there. But how do you distinguish a good health app? And research has said, has proven that the order of apps in the App Store doesn't say anything about quality, nor do user reviews, and nor do the descriptions of the app. They can sound scientific, but that doesn't mean that they are. A bit about the policy context of where we're working in. In 2014, there was a green paper on mobile health, which already mentioned how do we verify or ensure the efficacy of health apps? Should we perhaps have a certification scheme? And how do we better inform users? Now, via the Digital Single Market Strategy, 2018, we started in, I think, about 2019, creating CEN ISO 82304 Part 2, Health and Wellness Apps Quality and Reliability, where we created a common health app assessment framework and label. The European Health Data Space has been mentioned before, and currently we, as the Label2Enable project, we're creating an ISO 17067 compliant EU certification scheme aligned with EU values and EU legislation to issue a trusted CEN ISO 82304 Part 2 Health App Quality Label, Score and Report. So in short, we're the EU Energy Label, but then for health apps, so the scores A to E, as you can see, relate to labels, and the score on the left, as you can see, comes back at the bottom of the label. And you can also see we're translating it in different languages. So it's the same as the energy label, a score that translates to a label, and that then translates into a larger report with the detail needed. A bit about what we're trying to do to enable the many stakeholders involved. So patients and carers have previously said, there are so many health apps, I honestly don't know which one is good for me and relevant to me. And perhaps who's behind them and who should I trust. In Australia, they asked, who do you trust most to give you recommendations on health apps to consumers? And they said, well, my general practitioner. And then the general practitioner said, but I don't know either what a good health app is. And I lack a trustworthy source to access apps. If you're a manufacturer, it's quite difficult as well. How do you deliver a good health app when there are so many different frameworks? And if you want to get reimbursed, Germany is front runner with now 49 apps reimbursed. That's Germany. Belgium had 1 app reimbursed via a side route, and France recently launched Pecan. And finally, if you're an authority, the conclusion of this Nature article is there is a great interest in the use of apps in all the countries evaluated, but even the front runners struggle with efficient implementation and cross-national efforts are needed. So, CEN ISO, both for wellness and medical device apps, but we're not duplicating the work of notified bodies, inspired by the EU Energy Label. We tested the label with people with low health literacy. There's 81 questions behind it, of which at most 67 are score impacting yes, no questions. And if a manufacturer answers yes, they need to provide the evidence, which is then assessed by certified app assessors. The basis behind this question is a Delphi study with 83, that's a consensus study with 83 experts from 8 stakeholder groups. And maintenance is done by SENS, SENLEC, ISO, and IEC, who are, by the way, also behind the EU energy label. And of course, we're trying to achieve the same thing as the EU energy label. So over time, because you have more guidance on how to make and choose quality, the quality of the product actually increases. And these are the sales volumes. And the funny thing is we all benefit. The planet benefits, the consumers benefit because you pay less money. And then there's an additional business revenue of 21 billion euros and 324,000 jobs increase. So quite interesting. Going towards the European Health Data Space draft regulation, Article 31 is about voluntary labeling of wellness applications. So that's the core element from our perspectives, from our project's perspective. And this article relates to Annex number 2, which I'll quickly show you a bit about. In the end, it's mostly about interoperability and security. Yet here and there, patient safety is mentioned, and I think that is an important thing to take into account, and what you will see back in our label as well. It hasn't been decided yet what the label is going to be, which label it's going to be. That will be done in implementing acts later on. So this is the alignment in Annex 2, which does say something about being fit for use, so healthy and safe, easy to use, secure data, and a robust build. But as you can see, there's specific more requirements about interoperability and security. And perhaps that says a bit, we looked into different label legislations, trying to see what we could learn from energy labeling, from food labeling, from medicine labeling, and one of the things that we found is indeed the EHDS is more geared towards protection of personal data, whereas food labeling and medicinal products are more geared to also health. In the end, what we're trying to do is multi-stakeholder trust, use, and adoption. And for trust, we think it's very important to keep this health part in mind. So this is behind our project. In the end, we'd like to make sure that everybody benefits and uses the label. And for patient trust, what they've said before is so interesting in this study. They said, well, if I have a doctor recommending an app or it's made by a medical association, that actually influences my intent to download an mHealth app. And what do you then see? When is a GP going to recommend an app? For them, things like clinical validation are really, really important. And that's what we saw as well. We asked 1,228 people throughout the EU, who do you trust most to give you recommendations? And health professional and pharmacist were number 1 and 2. Yet in reality, they weren't used a lot yet. So here, again, research which says it's a health app. We want a health app to be healthy and safe. We want it to provide trustworthy and accurate information, and that's what we're trying to work towards. In the response to the European Health Data Space, the Standing Committee of European Doctor also mentioned we would like to get certified digital applications which comply with ISO standards, mentioning 82304 Part 2, and CE approved to be integrated in the EHR system. And in work that I recently did with the European Society of Cardiology, the importance of clinical benefit was really, really clear from the very start. A final thing, some of the results we already have in the project. We asked about patient trust as well. one of the things we asked is, do you think the government should review and rate health app quality to help you choose an app? And 86% said, yes, I think the government should do that, or pay another organization to review and rate apps to help me choose. And we did some research already with healthcare professionals, showing them 6 different situations. Would you recommend a health app, a prevention app, a self-management app, a healthcare app to a patient with low social economic status or high social economic status? And nicely, what we saw is that with a label, they were more willing to recommend in all situations. So that is, in short, something about Label2Enable and what we're creating, and our link just to the European health data space. And of course, this can also be seen as we'd like to be the label that is being decided upon in the implementing legislation. Thank you.